Good afternoon, and I want to thank each of you for being here today. Congressman, thank you for your presence. And over the past 24 hours, I've been in very close contact with the director of the CDC, Dr. Tom Frieden, as well as all the appropriate Texas state health officials. We're working very closely with the local, both the city and the county health officials as well in this very serious case as we partner. As you know, a patient was admitted to this hospital on September the 28th, subsequently tested positive for Ebola. Today we learned that some school-aged children have been identified as having had contact with the patient and are now being monitored at home for any signs of the disease. I know that parents are being extremely concerned about that development, but let me assure these children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms. I have full confidence in the medical professionals, in Superintendent Miles, in our local, our state, and our federal partners in keeping this contained. This is a disease that is not airborne and is substantially more difficult to contract than the common cold. We have experts here with us today who will be talking to you in a minute about the precautions that you may want to take. The medical community of North Texas, along with officials from the state and federal government, have been working together to take every step available and necessary to care for this patient's health and to ensure the safety and welfare of our citizens. There are few places in the world better equipped to meet the challenge that is posed in this case. Texas is one of only 13 states certified by the CDC to conduct diagnostic Ebola testing. And we have the healthcare professionals and the institutions that are second to none. The public should have every confidence that the highly trained professionals involved here will succeed in this very important mission. Public health investigators from Dallas County and from the Texas Department of State Health Services are working to identify, to locate, and monitor the health of all of those who have come into close contact with the patient. The highly qualified men and women of Texas Health Presbyterian are doing everything in their power to deliver the very best care for this patient. They have been and they will continue to be in close contact with federal, state, and local officials to ensure the public safety. This case is serious. Rest assured that our system is working as it should. Professionals on every level of the chain of command know what to do to minimize this potential risk to the people of Texas and of this country for that matter. I'd like to ask Dr. David Lakey, he is the head of our state health services, to come and share with you the efforts that are ongoing as we address this issue. David?
Yes, sir. Well, good morning, everyone. My name is David Lakey. I'm the Commissioner of the Texas Department of State Health Services, and I really appreciate you being here today. I want to echo several of the comments that were made by the governor. First, our thoughts and prayers are really with the family. They were notified about their loved one having Ebola yesterday. Obviously, is a scary diagnosis, and so our thoughts and prayers are with them right now, and also with the treatment team, those individuals in the healthcare that are caring for the individual right now. Since the outbreak of Ebola in West Africa, Texas has been taking steps to make sure that we are prepared for an event like this. A lot of education has taken place. A lot of protocols have been put in place. We've developed the ability to test for this virus since August, and to be able to do that in our laboratory. And that preparedness is not just taking place at the state level. preparedness was taking place here at the local level in this hospital. They took it really seriously. They've been educating their staff. They've been putting their own protocols in place so that they were ready to care for any individual that showed up with Ebola. So we've been on the lookout for this. I had the opportunity today to spend time with the team and talk to the management team and hear how they have been preparing for a long time for this event. And then I had the opportunity to talk to the infection control practitioners and actually go onto the ward and see firsthand the work that they're doing. And I want to let you know they're doing a great job. They're providing compassionate care. They have a committed staff that are providing top-notch care and are doing that in a safe environment. They have a whole ward that's dedicated to the care of this individual. They have a whole team of, again, professionals that are very competent caring for this individual and are doing it, as I noted, in a very safe, compassionate environment, providing excellent care. Now, obviously, this disease is scary to a large number of individuals, but I think some of the points that Dr. Frieden emphasized yesterday need to be restated. One of those statements that he said, and I want to reiterate, is that people cannot transmit this disease until they have symptoms. Okay? And so individuals that do not have symptoms are not going to transmit this disease to individuals. That chance of them transmitting it is zero. This virus is not transmitted by the air. It's not transmitted by the water. It is transmitted by direct contact with an individual, with their skin, or contact with blood or secretions or other bodily fluids. Or if there was a contaminated needle, then you could transmit this. But it's not going to be transmitted, again, through the air, through the casual contact with other individuals. I also want to make the case that this is not West Africa. This is a very sophisticated city, a very sophisticated hospital, and the dynamics are so significantly different than they are in East Africa, or excuse me, in West Africa, that the chances of it being spread are very, very, very small. And again, unless somebody has symptoms, it's not going to be spread to another individual. Our laboratory has been developing the ability to do this test. Since August, we've done the proficiency tests and have that ability to do that diagnostic test in our laboratory, and that ability is available to support the state of Texas. We do a rapid diagnostic test, a polymerase chain reaction, and again, the test yesterday, the controls worked as they were appropriately supposed to work, and the test was obviously positive. We take great care in our laboratory to inactivate the virus and to make sure that, again, our laboratory folks are safe, and it was done in a very safe manner. And we have a biothreat team that is specifically trained to handle these high-risk specimens. So a lot of work is taking place right now. A lot of investigation is taking place, identifying individuals that the family has been identified, contact has been made, messages have been conveyed to them about how do we need to approach the situation. And we will continue to work very closely with our federal partners at the CDC, our local partners with the Dallas County Health Department, with this hospital, with the Dallas city government, mayor and judge. Thank you for being here today. And with the full support of the state of Texas to make sure that we protect Texans and that we provide the care that needs to be provided. Thank you.
David, thank you. And let me add to that, Mayor Rollins and to Judge Jenkins, thank you both. This is all hands on deck. We understand that, and we've got great local partners, and everyone has their marching orders and understand the importance of that good collaboration, that good partnering from the state right through our federal partners with the CDC. So with that.